Allotransplantation, Wikipedia article audio. Allotransplant is the transplantation of cells, tissues, or organs, to a recipient from a genetically non-identical donor of the same species. The transplant is called an allograft, allogeneic transplant, or homograft. Most human tissue and organ transplants are allografts. It is contrasted with autotransplantation, syngeneic transplantation, and xenotransplantation. Procedure: transplantable organs and tissues. Allografts can be referred to as homostatic if they are biologically inert when transplanted, such as bone and cartilage. An immune response against an allograft or xenograft is termed rejection. An allogenic bone marrow transplant can result in an immune attack, called graft versus host disease. Informed consent is required before tissue is harvested from a donor, alive or dead. Proper screening for pathology and risk factors for communicable diseases such as HIV and hepatitis B and C is then conducted. In the U.S., donor tissue must be harvested and processed adhering to the current Good Tissue Practices rule. In most cases it is sent to tissue banks for processing and distribution. Each year, Food and Drug Administration regulated and American Association of Tissue Banks accredited tissue banks distribute 1.5 million bone and tissue allografts. A variety of organs and tissues can be used for allografts, including laws and regulations. In the U.S., the federal government Food and Drug Administration has regulated human tissue intended for transplants since 1993. In order to ensure the quality of donor tissue and reduce contamination and disease transmission risks, 3 regulations addressing manufacturing activities associated with human cells, tissues, and cellular and tissue-based products were promulgated in May 2005. The first requires companies producing and distributing HCT/PS to register with the FDA. The second, called the Donor Eligibility Rule, proscribes criteria for donor eligibility. The third, the current Good Tissue Practices Rule, oversees overall processing and distribution practices of each company. As with many operations, allotransplantation also has some side effects. A limiting factor in tissue allotransplantation for reconstructive surgery deals with the side effects of immunosuppression, which is a predominant issue. Also, it cannot be forgotten that the risk of transmitting infection is very high. Other transplant options. Risks: anterior cruciate ligament repair, joint reconstruction in the knee and ankle, meniscal replacement, reconstruction due to cancer or trauma, ridge augmentation in dental procedures, shoulder repair, spinal fusion, urological procedures, skin transplants, corneal transplants, heart transplants, heart valves, lung transplantation, intestinal transplantation, liver transplants, kidney transplants, pancreas transplantation, islet cell transplantation, bone marrow transplants, bone allograft, ligament or tendon. Allograft.